Question 1. Consider a scenario where a research team reports the incidental detection of a bacterial agent in a sentinel mouse colony. Preliminary literature review suggests this agent has zoonotic potential, though its prevalence and pathogenicity in the specific mouse strain and its transmission risk to humans in a laboratory setting are not definitively established. The research team proposes implementing enhanced personal protective equipment, PPE, and more frequent cage cleaning as immediate measures. What is the most appropriate course of action to ensure compliance with federal regulations and best practices for laboratory animal medicine? Option A. Enhance personal protective equipment and cage cleaning protocols, and independently research the agent's zoonotic potential to determine the level of risk before involving institutional committees. Option B. Proceed with the research as planned, relying on the proposed enhanced personal protective equipment and cleaning protocols, as these are standard biosafety practices. Option C. Immediately consult with the Institutional Biosafety Committee, IBC, and the Occupational Health and Safety OS program to conduct a formal risk assessment and develop appropriate containment and personnel protection strategies. Option D. Implement enhanced animal husbandry practices, focusing on improving the health and welfare of the sentinel colony, and monitor for any signs of illness in the animals. The correct answer is C. Immediately consult with the Institutional Biosafety Committee, IBC, and the Occupational Health and Safety, OS, program to conduct a formal risk assessment and develop appropriate containment and personnel protection strategies. Explanation. Scenario analysis. This scenario presents a significant implementation challenge due to the inherent ambiguity in interpreting and applying regulatory guidance for zoonotic disease prevention in a dynamic research environment. The challenge lies in balancing the imperative to protect human health and animal welfare with the operational demands of research, which may involve diverse species, novel agents, and evolving protocols. The presence of a potentially zoonotic agent, even if not definitively confirmed in the specific animal colony, necessitates a proactive and risk-based approach to containment and personnel protection. The difficulty arises from the need to make informed decisions with incomplete information, adhering to strict guidelines while ensuring research continuity and minimizing risk. Correct approach analysis. The correct approach, which involves immediate consultation with the Institutional Biosafety Committee, IBC, and the Occupational Health and Safety, OS, program, represents best professional practice by adhering to the established framework for managing biological risks in research settings. This aligns with the principles outlined in the Public Health Service, PHS, Policy on Humane Care and Use of Laboratory Animals, which mandates that institutions have mechanisms in place to address potential hazards, including zoonotic diseases. PHS policy, through its implementing regulations such as the Animal Welfare Act and its Animal Welfare Regulations, 9 CFR, and the Guide for the Care and Use of Laboratory Animals, the Guide, implicitly requires institutions to establish robust biosafety and occupational health programs. Consulting the IBC ensures that the proposed containment measures and personnel protection strategies are reviewed against established biosafety guidelines, e.g., CDC/NIH Biosafety in Microbiological and Biomedical Laboratories, and institutional protocols. Engaging the OHS program is critical for assessing human health risks, developing appropriate medical surveillance and post-exposure protocols, and ensuring compliance with Occupational Safety and Health Administration, OSHA, standards, particularly those related to bloodborne pathogens and hazard communication. This multidisciplinary consultation ensures a comprehensive risk assessment and the implementation of appropriate controls, thereby fulfilling ethical obligations and regulatory requirements. Incorrect approaches analysis. Proceeding with research without consulting the IBC or OHS program, based solely on the assumption that the agent is not a significant zoonotic threat in the specific colony, represents a significant regulatory and ethical failure. This approach bypasses established institutional safety protocols designed to protect both human and animal populations. It violates the spirit and intent of the PHS policy and the Guide, which emphasize a proactive and risk-averse approach to animal research. Specifically, it fails to adequately assess and mitigate potential human health risks, potentially exposing personnel to infectious agents without proper protective measures or medical oversight, which is a violation of OSHA standards. Furthermore, It neglects the ethical responsibility to ensure the well-being of the animals by not fully evaluating the implications of housing a potentially zoonotic agent within the colony, which could impact animal health and research integrity. Implementing enhanced personal protective equipment, PPE, and enhanced cleaning protocols without formal consultation with the IBC and OHS program is also an inadequate response. While these measures are components of biosafety, their sufficiency and appropriateness cannot be determined in isolation. Without a formal risk assessment by the IBC and OHS, the chosen PPE and cleaning protocols may be insufficient to contain the specific agent, or may impose unnecessary burdens on personnel and operations. This approach fails to ensure that the controls are scientifically sound and aligned with regulatory expectations for managing infectious agents, potentially leading to a false sense of security while actual risks remain unaddressed. Focusing solely on the animal welfare implications and implementing enhanced animal husbandry practices without involving OHS is incomplete. While animal welfare is paramount and addressed by the Animal Welfare Act and the Guide, the zoonotic potential of an agent directly impacts human health. Neglecting the human health component of the risk assessment and control strategy is a critical oversight that violates the integrated approach required by institutional policies and federal regulations designed to protect both animal and human health. Professional reasoning. In situations involving potential zoonotic agents, the professional decision-making process should be guided by a hierarchical approach to risk management, prioritizing consultation with established institutional oversight bodies. The first step is to recognize the potential hazard and the need for expert evaluation. This triggers the requirement to engage the Institutional Biosafety Committee, IBC, for assessment of biological containment and research protocols, and the Occupational Health and Safety, OHS, Program for Evaluation of Human Health Risks and Protective Measures. These committees provide the necessary expertise to conduct a thorough risk assessment, which informs the development of appropriate standard operating procedures, SOP, for animal handling, containment, waste disposal, and personnel protection. Adherence to these institutional protocols, which are designed to meet or exceed federal regulatory requirements, e.g., PHS policy, Animal Welfare Act, OSHA standards, is essential for ensuring compliance, protecting personnel and animal health, and maintaining research integrity. Question 2. The investigation demonstrates that a specific mouse strain, highly valuable for a critical immunology research project, carries a genetic mutation that, while not directly impacting the desired research phenotype, is strongly linked to an increased incidence of severe, painful joint degeneration in adult animals. The research team is eager to continue using this strain due to its unique genetic background. Option A. Continue breeding the strain without modification, prioritizing the research objectives, and relying on standard veterinary care to manage any signs of joint degeneration as they arise in individual animals. Option B. Implement a policy of breeding the strain and then performing euthanasia based on phenotypic signs of joint degeneration only after the animals have reached a certain age, to ensure sufficient research data is collected. Option C. Immediately cease all breeding of this mouse strain and seek an alternative strain, even if it requires significant time and resources to re-establish the research project. Option D. Develop and implement a rigorous genetic monitoring program for the strain, including regular screening for the specific mutation and establishing clear protocols for not breeding or culling animals exhibiting early signs of joint degeneration, in consultation with the IACUC. Correct answer is D. Develop and implement a rigorous genetic monitoring program for the strain, including regular screening for the specific mutation and establishing clear protocols for not breeding or culling animals exhibiting early signs of joint degeneration, in consultation with the IACUC. Explanation. Scenario analysis. This scenario presents a classic ethical dilemma in laboratory animal breeding programs, balancing scientific goals with animal welfare and regulatory compliance. The challenge lies in the potential for a genetically desirable trait to be linked with an undesirable health condition, forcing a difficult decision between advancing research and ensuring the well-being of the animals. The veterinarian must navigate the requirements of the Animal Welfare Act, OWA, and the Guide for the Care and Use of Laboratory Animals, the Guide, which mandate minimizing pain and distress and ensuring appropriate care, while also considering the ethical implications of perpetuating a potentially harmful genetic condition. Correct approach analysis. The correct approach prioritizes the welfare of the animals and adherence to regulatory principles, proactively developing and implementing a genetic monitoring program that includes screening for known deleterious mutations and establishing clear criteria for culling or not breeding animals with specific genetic conditions, aligns with the AWA's requirement to provide humane care and the guide's emphasis on preventing and minimizing pain and distress. This approach demonstrates a commitment to responsible breeding practices, where the potential for genetic defects is anticipated and managed, rather than reacting to problems after they arise. It also supports the principle of the 3Rs: replacement, reduction, refinement, by aiming to reduce the incidence of animals suffering from genetic disorders. Incorrect approaches analysis. One incorrect approach involves continuing to breed the affected line without intervention, solely because the genetic trait is scientifically valuable. This fails to adequately address the potential for increased suffering in the offspring, violating the AWA's mandate for humane care and the guide's principles of minimizing pain and distress. It prioritizes research objectives over animal welfare, which is ethically unacceptable and potentially non-compliant. Another incorrect approach is to immediately cease all breeding of the affected line without further investigation or consultation. While well-intentioned, this may be an overreaction and could unnecessarily halt valuable research if the genetic condition can be managed, or if the trait can be segregated from the deleterious mutation through careful breeding strategies. It lacks a nuanced, evidence-based approach to genetic management. A third incorrect approach is to rely solely on post-mortem examination to identify affected animals. This reactive strategy does not prevent the suffering of animals that develop the condition during their lifetime. It fails to implement proactive measures for genetic health management, which is a core component of responsible laboratory animal husbandry and a key expectation under the AWA and the guide. Professional reasoning. Professionals should approach such dilemmas by first thoroughly investigating the genetic linkage and the severity of the associated health condition. This involves consulting with geneticists and veterinarians. The next step is to evaluate the potential for managing the condition or segregating the desirable trait from the deleterious mutation through a carefully designed breeding strategy. If these options are not feasible or do not adequately protect animal welfare, then decisions regarding culling, not breeding, or even phasing out the line must be made in consultation with the Institutional Animal Care and Use Committee, IACUC, ensuring full compliance with the AWA and the guide. The overarching principle is to make decisions that minimize animal suffering while still supporting legitimate research objectives. Question 3. Upon reviewing the daily health monitoring records for a cohort of genetically modified mice in a cardiovascular research study, the attending veterinarian notes a significant increase in respiratory rate and decreased activity in several animals. The study protocol involves inducing a specific cardiac condition to assess therapeutic efficacy, and the veterinarian is aware that the induced condition can sometimes lead to secondary pulmonary complications. The veterinarian must decide on the immediate course of action. Which of the following represents the most appropriate and ethically sound approach, adhering to U.S. federal regulations and guidelines for laboratory animal care and use? Option A. Immediately euthanize the affected animals to prevent further suffering and to avoid any potential confounding effects on the study data, as the observed signs might indicate a deviation from the intended disease progression. Option B. Continue to monitor the animals closely without intervention, assuming the observed signs are an expected part of the induced pathology and will resolve on their own, to ensure the integrity of the research data. Option C. Initiate a new treatment regimen for the respiratory distress that is not outlined in the approved protocol, believing that improving the animal's condition will ultimately benefit the study's success. Option D. Administer supportive care to alleviate the respiratory distress and consult with the principal investigator and the Institutional Animal Care and Use Committee, IACUC, to discuss potential protocol amendments or adjustments to the monitoring plan, considering the impact on research outcomes. The correct answer is D. Administer supportive care to alleviate the respiratory distress and consult with the principal investigator and the Institutional Animal Care and Use Committee, IACUC, to discuss potential protocol amendments or adjustments to the monitoring plan, considering the impact on research outcomes. Explanation. This scenario presents a professional challenge because it requires the veterinarian to balance the immediate needs of a research animal with the long-term goals of a study, all while adhering to strict federal regulations and ethical guidelines governing animal research in the United States. The veterinarian must critically assess the animal's physiological status, understand how potential interventions might impact the research data, and consult relevant protocols and expert opinions. Careful judgment is required to ensure animal welfare is prioritized without compromising the scientific integrity of the study, a core tenet of the Animal Welfare Act and the Guide for the Care and Use of Laboratory Animals. The correct approach represents best professional practice because it involves a comprehensive, data-driven, and collaborative decision-making process. This approach prioritizes the animal's well-being by seeking to alleviate suffering through appropriate veterinary intervention, while simultaneously acknowledging the potential impact on the research. Consulting the IACUC and the principal investigator ensures that any intervention is considered within the context of the approved protocol and the study's objectives, aligning with the ethical principles of the 3Rs: replacement, reduction, refinement, and the regulatory framework that mandates oversight of animal use in research. This demonstrates a commitment to both animal welfare and scientific rigor. An incorrect approach that focuses solely on alleviating the animal's immediate distress without considering the research implications would be professionally unacceptable. This could lead to the introduction of confounding variables, rendering the research data invalid and potentially necessitating the repetition of the study, which is contrary to the principle of reduction. It also fails to adequately engage with the established oversight mechanisms, IACUC, designed to ensure that research is conducted ethically and scientifically. Another incorrect approach that prioritizes the research data above all else, leading to the decision to withhold necessary veterinary care, would be a severe ethical and regulatory failure. This directly violates the Animal Welfare Act's requirement for humane care and treatment, and the Guide's emphasis on minimizing pain and distress. Such an approach demonstrates a disregard for animal welfare and a lack of understanding of the veterinarian's ethical obligations. A third incorrect approach that involves making a unilateral decision without consulting the IACUC or the principal investigator is also professionally unacceptable. This bypasses the established oversight process, which is crucial for ensuring that animal use is justified, humane, and scientifically sound. It undermines the collaborative nature of animal research and the veterinarian's role as a steward of animal welfare within the research setting. The professional decision-making process for similar situations should involve a systematic evaluation. First, assess the animal's physiological status and the severity of its condition. Second, determine the potential impact of various interventions on the research objectives. Third, consult the approved animal care and use protocol and relevant scientific literature. Fourth, engage in open communication with the principal investigator and the IACUC to discuss findings and potential courses of action. And finally, make a decision that best balances animal welfare with scientific integrity, always documenting the rationale and actions taken. Question 4. Benchmark analysis indicates that a novel research protocol proposes the use of a genetically modified rodent model exhibiting a progressive neurological phenotype. The protocol aims to evaluate the efficacy of a new therapeutic agent. The veterinarian responsible for reviewing the animal care and use aspects of this protocol must identify and address potential risks to animal welfare. Which of the following approaches best aligns with the regulatory framework and ethical considerations for laboratory animal medicine in the United States? Option A. Recommend proceeding with the protocol as designed, assuming that standard veterinary care will be sufficient to manage any unforeseen animal welfare issues that may arise during the study. Option B. Focus primarily on the scientific validity and potential impact of the therapeutic agent, with a secondary consideration for animal welfare, assuming the research goals justify any potential animal suffering. Option C. Suggest implementing the protocol with minimal oversight, relying on the researcher's discretion to administer pain relief only when obvious signs of severe distress are observed, to avoid confounding the experimental results. Option D. Propose a comprehensive risk assessment that identifies potential pain and distress associated with the neurological phenotype and therapeutic intervention, and outlines specific mitigation strategies including appropriate analgesia, anesthesia, humane endpoints, and monitoring parameters, ensuring alignment with the 3Rs and PHS policy. The correct answer is D. Propose a comprehensive risk assessment that identifies potential pain and distress associated with the neurological phenotype and therapeutic intervention, and outlines specific mitigation strategies including appropriate analgesia, anesthesia, humane endpoints, and monitoring parameters, ensuring alignment with the 3RS and PHS policy. Explanation. This scenario is professionally challenging because it requires balancing the need for scientific advancement with the ethical and regulatory obligations to minimize animal suffering and ensure humane care. The veterinarian must interpret and apply the Animal Welfare Act, AWA, and its implementing regulations, 9 CFR, to a novel research protocol, demonstrating a deep understanding of risk assessment principles within the context of laboratory animal medicine. Careful judgment is required to identify potential risks, evaluate their severity and likelihood, and propose appropriate mitigation strategies that align with both scientific goals and regulatory compliance. The correct approach represents best professional practice because it systematically addresses the potential risks to animal welfare by integrating expert knowledge with regulatory requirements. This involves a thorough review of the protocol, identification of potential pain and distress, and the development of specific interventions to mitigate these risks. This aligns with the principles of the 3RS, replacement, reduction, refinement, and the requirements of the AWA and PHS policy, which mandate that research involving animals be reviewed by an institutional animal care and use committee, IACUC, to ensure it is scientifically justified and humane. The veterinarian's role is to facilitate this review by providing expert assessment of the animal care and use aspects of the protocol. An incorrect approach that focuses solely on the scientific merit of the research without adequately considering animal welfare would be a significant regulatory and ethical failure. The AWA and PHS policy explicitly require that the potential pain and distress be minimized and that alternatives be considered. Similarly, an approach that relies on vague or generalized statements about animal care without specific, actionable mitigation strategies fails to meet the detailed requirements for protocol review and oversight. This would likely result in an IACUC deferral or disapproval, as it does not demonstrate due diligence in protecting animal welfare. An approach that prioritizes cost-effectiveness over animal welfare would also be a direct violation of ethical principles and regulatory mandates, as the AWA and PHS policy prioritize humane treatment and minimization of suffering above financial considerations. Professional reasoning in such situations should involve a structured risk assessment process. This begins with a comprehensive understanding of the proposed research procedures and their potential impact on the animals. Next, the veterinarian must identify all potential sources of pain, distress, or suffering, considering both acute and chronic effects. This is followed by an evaluation of the likelihood and severity of these potential harms. Based on this assessment, specific mitigation strategies should be developed, including the use of analgesia, anesthesia, humane endpoints, environmental enrichment, and appropriate handling techniques. Finally, these proposed measures must be clearly documented and communicated to the IACUC for review and approval, ensuring transparency and accountability in animal research. Question 5. Examination of the data shows that a research team is investigating the impact of a novel therapeutic agent on anxiety-like behaviors in rodents. They are considering several potential behavioral models to assess this impact. Which of the following approaches best balances scientific rigor with the ethical imperative to minimize animal distress and adhere to regulatory guidelines? Option A. Opting for a behavioral model that is easily administered and requires minimal specialized equipment, even if its scientific relevance to anxiety-like behaviors is questionable and enrichment is not a primary consideration. Option B. Utilizing a standard behavioral test known to induce significant fear and anxiety in rodents, with the rationale that the therapeutic agent should ideally overcome these strong negative states and minimal attention paid to enrichment. Option C. Selecting a well-validated, species-appropriate behavioral test that has demonstrated sensitivity to anxiolytic effects, coupled with a comprehensive plan for environmental enrichment and gentle handling techniques to mitigate potential stress. Option D. Implementing a novel, complex behavioral paradigm that has not been extensively validated, but is hypothesized to be highly sensitive to subtle changes in anxiety, without a detailed plan for managing potential animal distress. The correct answer is C. Selecting a well-validated, species-appropriate behavioral test that has demonstrated sensitivity to anxiolytic effects, coupled with a comprehensive plan for environmental enrichment and gentle handling techniques to mitigate potential stress. Explanation. Scenario analysis. This scenario presents a common challenge in laboratory animal research, where the interpretation of behavioral data is critical for scientific validity and animal welfare. The investigator must balance the need for robust scientific outcomes with the ethical imperative to minimize animal distress and ensure that behavioral assessments are not confounded by factors that could lead to misinterpretation or unnecessary suffering. The professional challenge lies in selecting the most appropriate behavioral model and assessment strategy that aligns with scientific objectives while adhering to the principles of the Animal Welfare Act, OWA, and the Guide for the Care and Use of Laboratory Animals, the Guide. Correct approach analysis. The correct approach prioritizes the scientific validity of the behavioral model and its relevance to the research question, while also considering the potential for distress and the availability of appropriate enrichment and handling techniques. This aligns with the principles of the AWA, which mandates humane care and treatment, and the Guide, which emphasizes the importance of appropriate housing, management, and veterinary care, including the consideration of species-specific behavioral needs. Selecting a model that is well-established, validated for the specific research question, and for which appropriate welfare considerations can be implemented, represents best professional practice. This approach ensures that the data generated is scientifically sound and that the animal's well-being is maintained, fulfilling the ethical obligations of researchers and veterinarians. Incorrect approaches analysis. One incorrect approach might involve selecting a behavioral model solely based on its perceived simplicity or ease of implementation, without rigorous scientific validation or consideration of species-specific behavioral needs. This could lead to the generation of unreliable data, compromising the scientific integrity of the research. Ethically, it fails to meet the standards of the Guide, which stresses the importance of using appropriate models that minimize pain and distress. Another incorrect approach could be to prioritize the generation of a specific behavioral phenotype without adequately assessing the potential for the model to induce chronic stress or suffering. This would violate the principles of the AWA and the Guide, which require researchers to implement measures to alleviate pain and distress and to ensure that the animal's environment supports their well-being. The use of a model that causes undue suffering, even if it yields desired behavioral data, is ethically unacceptable. A third incorrect approach might be to overlook the need for species-appropriate environmental enrichment or handling protocols, assuming that the behavioral model itself is sufficient. This neglects the fundamental requirements for animal welfare outlined in the Guide, which emphasizes that enrichment and proper handling are integral to minimizing stress and ensuring the animal's psychological well-being, thereby impacting the validity of behavioral assessments. Professional reasoning. Professionals should approach the selection and implementation of behavioral models by first clearly defining the research question and identifying potential behavioral endpoints. They must then conduct a thorough literature review to identify validated models relevant to the question and species of interest. Crucially, they must assess the potential for animal distress associated with the model and develop comprehensive plans for mitigation, including appropriate housing, enrichment, handling, and veterinary oversight. This systematic process ensures that scientific objectives are met responsibly and ethically, in full compliance with regulatory requirements. Question 6. Performance analysis shows that a critical research project requiring a specific strain of mice is significantly behind schedule due to delays in obtaining the animals. The vendor has informed the facility that the next available shipment can be expedited, but only if the standard 30-day quarantine period is waived for this specific shipment, with the justification that the vendor has a robust internal health monitoring program. The principal investigator is pressuring the veterinarian to approve this waiver to meet an upcoming grant deadline. What is the most appropriate course of action for the laboratory animal veterinarian? Option A. Approve the waiver but house the new mice in a separate room within the same facility without a formal quarantine period, relying on the vendor's internal health monitoring. Option B. Waive the quarantine period for the new mice, citing the vendor's internal health monitoring program as sufficient justification to meet the research project's deadline. Option C. Deny the waiver request and insist on the full 30-day quarantine period for the new mice, explaining the rationale and potential risks to the existing colony and research integrity. Option D. Proceed with housing the new mice directly into the main animal housing area and address any potential health issues as they arise during the research. The correct answer is C. Deny the waiver request and insist on the full 30-day quarantine period for the new mice, explaining the rationale and potential risks to the existing colony and research integrity. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in laboratory animal medicine, where a perceived immediate benefit to research, avoiding a costly and time-consuming quarantine for a new animal source, conflicts with established protocols for disease prevention and animal welfare. The challenge lies in balancing the demands of research timelines and budgets with the ethical and regulatory imperative to protect the health of the existing animal colony and prevent the introduction of novel pathogens. The veterinarian must weigh the potential risks of bypassing established procedures against the perceived benefits, recognizing that failure to adhere to proper health monitoring can have significant consequences for animal health, research integrity, and regulatory compliance. Correct approach analysis. The correct approach prioritizes the health and welfare of the existing animal colony and the integrity of research by adhering to established health monitoring and disease prevention protocols, including quarantine. This aligns directly with the principles of the Animal Welfare Act, OWA, and the Guide for the Care and Use of Laboratory Animals, the Guide, which mandate the implementation of programs for the health and care of animals. Specifically, the Guide emphasizes the importance of preventing the introduction of diseases through proper quarantine and health surveillance of newly acquired animals. Adhering to these protocols ensures that any potential pathogens are identified and managed before they can spread to the established colony, thereby protecting animal health, maintaining research validity, and avoiding costly disruptions and potential regulatory violations. This proactive approach is the cornerstone of responsible animal care and research. Incorrect approaches analysis. Bypassing the quarantine period for the new shipment of mice, despite the perceived urgency of the research project, represents a significant regulatory and ethical failure. This action directly contravenes the principles of disease prevention and biosecurity mandated by the AWA and the Guide. The potential introduction of an unknown pathogen could compromise the health of the existing colony, leading to animal suffering, research data invalidation, and the need for extensive diagnostic work and potential culling of animals. This approach prioritizes short-term research convenience over long-term animal welfare and research integrity, suggesting that the new animals be housed in a separate room within the same facility without a formal quarantine period also fails to meet regulatory and ethical standards. It offers some degree of separation. It does not provide the necessary controlled environment and comprehensive health surveillance required to detect and prevent the introduction of pathogens. The risk of cross-contamination through shared air handling systems, personnel traffic, or shared equipment remains high, jeopardizing the health of the entire facility's animal population. This approach demonstrates a misunderstanding of the critical role of a properly managed quarantine in biosecurity. Proposing to proceed with the research immediately and address any potential health issues as they arise is a highly irresponsible and ethically unacceptable approach. This reactive strategy places the existing animal colony at extreme risk of widespread disease outbreak. It disregards the fundamental principle of disease prevention and prioritizes immediate research progress at the expense of animal welfare and research integrity. Such an approach would likely lead to significant animal suffering, research failures, and severe regulatory repercussions. Professional reasoning. Professionals faced with this situation should first consult and strictly adhere to the institution's established standard operating procedures, SOP, for animal procurement, quarantine, and health monitoring, which are designed to comply with federal regulations and guidelines. They should then engage in open communication with the research team, clearly explaining the rationale behind the quarantine protocols, the potential risks of non-compliance, and the long-term implications for both animal welfare and research validity. If there are genuine constraints on research timelines, the veterinarian should explore alternative solutions that do not compromise biosecurity, such as working with the vendor to expedite health screening prior to shipment or identifying alternative animal sources that can meet the required timeline while still adhering to quarantine protocols. The decision-making process must be guided by a commitment to animal welfare, research integrity, and regulatory compliance, always erring on the side of caution when animal health is at stake. Question 7. System analysis indicates that a long-standing research protocol, established decades ago, utilizes a specific surgical procedure for a particular animal model. Historical records suggest this procedure was considered standard practice at the time of its inception and has been performed consistently since. However, current veterinary literature and advancements in anesthetic and analgesic techniques offer alternative methods that may reduce animal distress and improve recovery. Considering the evolution of laboratory animal medicine and its governing principles, which approach best reflects current professional standards and regulatory expectations for the care and use of laboratory animals in the United States. Option A. Review the historical procedure in light of current scientific literature, ethical considerations, and the principles outlined in the Animal Welfare Act and the Guide for the Care and Use of Laboratory Animals, to determine if refinements or alternatives can be implemented to enhance animal welfare while maintaining scientific integrity. Option B. Implement the alternative surgical techniques without further review, assuming they are inherently superior to all historical methods, and disregard the original protocol's scientific objectives. Option C. Immediately halt all research utilizing the established surgical procedure and seek to replace the animal model entirely, regardless of the scientific impact or feasibility of alternative models. Option D. Continue performing the established surgical procedure without modification, citing its historical precedent and consistent use as justification for its ongoing appropriateness. Correct answer is D. Continue performing the established surgical procedure without modification, citing its historical precedent and consistent use as justification for its ongoing appropriateness. Explanation. Scenario analysis. This scenario presents a common challenge in laboratory animal medicine, balancing the historical context of animal use with evolving ethical standards and regulatory frameworks. The veterinarian must navigate the legacy of past practices, which may have been less stringent, against current expectations for animal welfare and scientific rigor. This requires a deep understanding of the historical trajectory of the field to inform present-day decision-making and to advocate for continuous improvement. The challenge lies in recognizing that, while historical practices were once accepted, they may not align with current ethical imperatives or the principles of the Animal Welfare Act, (AWA), and its implementing regulations, as well as the Guide for the Care and Use of Laboratory Animals, the Guide. Correct approach analysis. The correct approach emphasizes the historical evolution of laboratory animal medicine, acknowledging past practices while firmly grounding current actions in contemporary ethical principles and regulatory requirements. This involves understanding how the AWA, the Guide, and institutional policies have evolved to promote humane care and use. It recognizes that historical precedent alone is insufficient justification for current practices, and that adherence to current standards, including the principles of the 3Rs, replacement, reduction, refinement, is paramount. This approach demonstrates a commitment to continuous improvement and ethical responsibility, reflecting the core tenets of laboratory animal science as defined by the DACLAM certification. Incorrect approach is analysis. An approach that relies solely on historical precedent without critically evaluating it against current ethical and regulatory standards is fundamentally flawed. For example, if a historical practice involved methods now considered inhumane or scientifically unsound, continuing it based on tradition would violate the AWA's mandate for humane care and the Guide's emphasis on minimizing pain and distress. Similarly, an approach that prioritizes historical research findings over current animal welfare regulations would be unacceptable. The AWA and the Guide are living documents, subject to revision based on scientific advancements and societal values. Ignoring these updates in favor of outdated practices constitutes a regulatory and ethical failure. Furthermore, an approach that dismisses the importance of the 3Rs, which are central to modern laboratory animal science and are implicitly or explicitly supported by regulatory frameworks, would be professionally unsound. Professional reasoning. Professionals in laboratory animal medicine must adopt a forward-looking perspective informed by historical understanding. The decision-making process should involve 1. Identifying the current ethical and regulatory landscape, AWA, Guide, institutional policies. 2. Researching the historical context of the practice in question, understanding why it was adopted and how it has evolved. 3. Critically evaluating the historical practice against current standards, considering the 3 Rs and principles of humane care. 4. Advocating for and implementing practices that align with current ethical and regulatory requirements, even if they differ from historical norms. This iterative process ensures that animal welfare is continuously prioritized and that scientific endeavors are conducted responsibly and ethically. Question 8. Analysis of a research protocol proposing the introduction of a novel genetically modified mouse line with an unknown but potentially significant impact on immune function and susceptibility to infectious agents. What is the most appropriate initial step to ensure regulatory compliance and animal welfare? Option A. Rely on the principal investigator's extensive experience with similar mouse models to implement housing and husbandry without formal IACUC review. Option B. Immediately implement stringent biocontainment measures based on the most extreme potential outcome, regardless of the likelihood of such an outcome, to err on the side of caution. Option C. Conduct a comprehensive risk assessment involving the IACUC, veterinary staff, and relevant subject matter experts to determine appropriate housing, husbandry, and containment protocols prior to animal acquisition. Option D. Proceed with acquiring the animals and initiating standard housing and husbandry protocols, with the understanding that any emergent issues will be addressed reactively. The correct answer is C. Conduct a comprehensive risk assessment involving the IACUC, veterinary staff, and relevant subject matter experts to determine appropriate housing, husbandry, and containment protocols prior to animal acquisition. Explanation. This scenario presents a common challenge in laboratory animal research involving genetically modified organisms, GMO. The professional challenge lies in balancing the scientific imperative to utilize novel GMOs for advancing knowledge with the ethical and regulatory obligations to ensure animal welfare and containment. The complexity arises from the potential for unforeseen phenotypes, altered disease susceptibility, and the need for specialized housing and handling protocols that may not be immediately apparent or fully characterized. Careful judgment is required to proactively identify and mitigate risks associated with novel GMOs. The correct approach represents best professional practice because it prioritizes a comprehensive, risk-based evaluation before the introduction of the GMO into the research setting. This aligns with the principles of the Animal Welfare Act (OWA) and the Guide for the Care and Use of Laboratory Animals, the Guide, which mandate that all procedures involving animals are reviewed and approved by an institutional animal care and use committee (IACUC). A thorough risk assessment, including consultation with veterinary staff and geneticists, is crucial for identifying potential welfare concerns, determining appropriate housing and husbandry, and establishing necessary containment measures. This proactive approach ensures compliance with federal regulations and ethical standards by minimizing potential harm to animals and preventing unintended environmental release. An incorrect approach that fails to conduct a comprehensive risk assessment before introducing the GMO is professionally unacceptable. This oversight represents a direct violation of the AWA's requirement for IACUC review and approval of all animal use protocols. Ethically, it demonstrates a failure to uphold the principles of the 3 Rs, replacement, reduction, refinement, by not adequately considering potential animal suffering or distress that could arise from uncharacterized genetic modifications. Furthermore, it neglects the importance of biosafety and biosecurity, potentially leading to the uncontrolled spread of genetically modified material, which is a regulatory concern under various federal guidelines. Another incorrect approach that relies solely on the researcher's personal assessment of risk, without formal IACUC review or veterinary consultation, is also professionally unacceptable. This bypasses the established regulatory framework designed to provide independent oversight and expertise. The researcher, while knowledgeable in their specific field, may lack the comprehensive understanding of animal physiology, welfare, and containment principles that the IACUC and veterinary staff possess. This can lead to inadequate protocols, increased animal suffering, and potential noncompliance with federal regulations. The professional decision-making process for similar situations should involve a systematic, multidisciplinary approach. First, researchers must initiate the process by submitting a detailed protocol to the IACUC that clearly outlines the genetic modification, its intended purpose, and any known or anticipated effects on the animals. Second, the IACUC, in conjunction with veterinary staff and relevant subject matter experts, e.g., geneticists, biosafety officers, must conduct a thorough risk assessment. This assessment should consider the potential for altered physiology, behavior, disease susceptibility, and environmental impact. Third, based on the risk assessment, specific housing, husbandry, veterinary care, and containment protocols must be developed and implemented. Finally, ongoing monitoring and re-evaluation of the GMO's impact on animal welfare and the effectiveness of containment measures are essential throughout the research project. Question 9. Quality control measures reveal a consistent deviation in the administration of a critical experimental compound to a cohort of research animals, deviating from the approved protocol's specified volume and injection site. This deviation has been occurring for several weeks, impacting a significant portion of the study's data collection. Option A. Implement a minor procedural adjustment for future administrations without retraining personnel or formally revising the protocol, assuming the deviation was an isolated oversight. Option B. Conduct a thorough investigation to identify the root cause of the deviation. Revise the protocol to reflect the actual practice if scientifically justified and approved by the IACUC, and implement comprehensive retraining for all personnel involved in the procedure. Option C. Immediately halt all research activities involving the affected animal cohort and initiate a full audit of all research protocols to identify any other potential deviations. Option D. Document the deviation in the animal care records, but allow the current research to continue to completion to avoid compromising the study's timeline and potential findings. The correct answer is B. Conduct a thorough investigation to identify the root cause of the deviation. Revise the protocol to reflect the actual practice if scientifically justified and approved by the IACUC, and implement comprehensive retraining for all personnel involved in the procedure. Explanation. Scenario analysis. This scenario presents a common implementation challenge in laboratory animal research, where a deviation from established protocols is identified during routine quality control. The challenge lies in balancing the need for scientific integrity and animal welfare with the practicalities of ongoing research. The identified deviation, if unaddressed, could compromise the validity of research findings and potentially impact animal well-being, necessitating a prompt and ethically sound resolution. The veterinarian's role is critical in ensuring compliance with the Animal Welfare Act, (AWA), and the Guide for the Care and Use of Laboratory Animals, the Guide, which are foundational to responsible animal research in the U.S. Correct approach analysis. The correct approach involves a thorough investigation to understand the root cause of the deviation, followed by a collaborative effort to revise the protocol and retrain personnel. This aligns with the principles of the AWA and the Guide, which mandate that animal care and use protocols are reviewed and approved by an institutional animal care and use committee IACUC, and that personnel are adequately trained. By investigating the cause, revising the protocol, and retraining staff, the institution demonstrates a commitment to scientific rigor, animal welfare, and regulatory compliance. This proactive and systematic approach ensures that future research is conducted according to approved standards, minimizing risks to both animal welfare and data integrity. Incorrect approaches analysis. One incorrect approach involves ignoring the deviation to avoid disrupting ongoing experiments. This is a significant regulatory and ethical failure. The AWA requires adherence to approved protocols, and the Guide emphasizes the importance of proper animal care and use. Ignoring a deviation undermines the IACUC oversight and the integrity of the research, potentially leading to compromised scientific outcomes and animal suffering. Another incorrect approach is to immediately terminate the affected research without a thorough investigation. While animal welfare is paramount, abrupt termination without understanding the cause or impact can be an overreaction and may not be the most efficient or scientifically sound solution. The Guide encourages adaptive management and continuous improvement, which includes understanding deviations before implementing drastic measures. A third incorrect approach is to implement a superficial fix, such as a minor procedural adjustment, without addressing the underlying cause or retraining personnel. This fails to ensure sustained compliance and may lead to recurring deviations. The guide stresses the importance of comprehensive training and protocol adherence to maintain high standards of animal care and research quality. Professional reasoning. When faced with such a situation, a laboratory animal veterinarian should initiate a systematic problem-solving process. This begins with a thorough review of the quality control findings and the relevant approved protocol. The next step is to conduct a root cause analysis to identify why the deviation occurred. This may involve interviewing personnel, reviewing records, and observing procedures. Based on the findings, the veterinarian should collaborate with the research team and the IACUC to develop a corrective action plan. This plan should include protocol revisions, if necessary, comprehensive retraining of all involved personnel, and a plan for monitoring to ensure the deviation is resolved and does not recur. This approach prioritizes animal welfare, scientific integrity, and regulatory compliance, reflecting best professional practice. Question 10. The evaluation methodology shows that a proposed research protocol involving a novel surgical procedure on rodents is expected to cause significant post-operative pain. While the protocol outlines standard analgesia, the principal investigator expresses concern that the analgesia may not fully mitigate the expected pain, potentially impacting the scientific outcomes due to animal distress. The veterinarian reviewing the protocol is aware of emerging refinement techniques that could reduce the invasiveness of the procedure and potentially lessen post-operative pain, but these techniques are less familiar to the research team and may require additional training and resources. What is the most appropriate course of action for the veterinarian? Option A. Recommend consultation with specialists in surgical refinement and animal behavior to explore and implement advanced pain management and procedural modifications, even if it requires additional resources and training for the research team. Option B. Advise the principal investigator that, while animal welfare is important, the scientific objectives of the protocol should take precedence, and the current analgesia plan should be followed. Option C. Approve the protocol as submitted, assuming the standard analgesia will be sufficient, and that the principal investigator's concerns are primarily related to potential scientific variability rather than unacceptable animal suffering. Option D. Suggest that the research team proceed with the protocol as written and document any observed signs of severe pain, which can be addressed if they become problematic during the study. The correct answer is A. Recommend consultation with specialists in surgical refinement and animal behavior to explore and implement advanced pain management and procedural modifications, even if it requires additional resources and training for the research team. Explanation. The evaluation methodology shows a potential conflict between the scientific objectives of a research protocol and the established principles of animal welfare, specifically the 3Rs: replacement, reduction, refinement. The challenge lies in balancing the need for scientific advancement with the ethical imperative to minimize animal use and suffering. A veterinarian's role in this scenario is to advocate for the animals while ensuring the scientific integrity and ethical compliance of the research. The correct approach prioritizes the ethical and regulatory obligations to refine procedures to minimize pain and distress, even if it requires additional resources or a slight modification to the original experimental design. This aligns with the principles of the Animal Welfare Act, AWA, and the Guide for the Care and Use of Laboratory Animals, the Guide, which mandate the humane care and use of animals and the implementation of the 3Rs. Specifically, the Guide emphasizes that protocols should be reviewed for opportunities to refine procedures to alleviate pain or distress. Seeking expert consultation for refinement techniques is a proactive and responsible step that demonstrates a commitment to animal welfare and regulatory compliance. An incorrect approach would be to proceed with the protocol as written without considering potential refinements, thereby failing to meet the ethical and regulatory obligation to minimize animal suffering. This could lead to unnecessary pain and distress for the animals, violating the principles of the AWA and the Guide. Another incorrect approach would be to dismiss the concerns about potential pain without a thorough investigation or consultation, which neglects the veterinarian's responsibility to advocate for animal welfare. Finally, prioritizing the convenience of the research staff over the welfare of the animals, or assuming that the current protocol is inherently humane without further evaluation, represents a failure to uphold professional ethical standards and regulatory requirements. Professionals should approach such situations by first thoroughly understanding the scientific objectives and the proposed procedures. They should then critically evaluate the protocol against the principles of the 3RS and relevant regulations. If potential welfare concerns are identified, the next step is to consult with the principal investigator and the Institutional Animal Care and Use Committee, IACUC. Seeking expert advice, such as from a veterinary behaviorist or a surgeon experienced in the specific procedure, is crucial for identifying and implementing appropriate refinements. This collaborative and evidence-based approach ensures that animal welfare is maximized while still allowing for scientifically sound research. Question 11. Research into the effects of a novel anesthetic agent on the cardiovascular system of Sprague Dawley rats reveals subtle, transient bradycardia and hypotension post-induction. The veterinarian overseeing the protocol observes these changes, which are not explicitly detailed as expected adverse events in the approved animal study protocol, ASP, but are within the known physiological range for this species under anesthesia. What is the most appropriate immediate course of action? Option A. Document the findings but take no immediate action, assuming the changes are within acceptable physiological variation and will resolve spontaneously. Option B. Administer a broad-spectrum analgesic and fluid therapy without consulting the principal investigator to proactively manage any potential discomfort or hypovolemia. Option C. Closely monitor the animal's vital signs and consult with the principal investigator to discuss the observed physiological changes and their potential impact on the study, while reviewing the literature for similar findings. Option D. Immediately administer a standard reversal agent for the anesthetic and terminate the experimental procedure to prevent potential harm. The correct answer is C. Closely monitor the animal's vital signs and consult with the principal investigator to discuss the observed physiological changes and their potential impact on the study, while reviewing the literature for similar findings. Explanation. This scenario presents a professionally challenging situation because it requires the veterinarian to balance the immediate needs of a research protocol with the ethical and regulatory obligations to ensure animal welfare. The challenge lies in interpreting subtle physiological changes that could indicate distress or pain and determining the appropriate course of action without compromising the scientific integrity of the study. Careful judgment is required to distinguish between expected physiological responses to a procedure and signs of adverse events that necessitate intervention. Correct approach represents best professional practice because it prioritizes the animal's well-being while adhering to the principles of the Animal Welfare Act, OWA, and the Guide for the Care and Use of Laboratory Animals, the Guide. Specifically, the veterinarian's decision to closely monitor the animal and consult with the principal investigator, PI, demonstrates a commitment to the 3RS, replacement, reduction, refinement, by seeking to refine the procedure if necessary. This proactive monitoring and communication aligns with the AWA's mandate to prevent unnecessary pain and distress, and the Guide's emphasis on appropriate veterinary care and humane endpoints. An incorrect approach that involves ignoring the subtle changes would be a significant regulatory and ethical failure. This would violate the AWA's requirement for prompt and adequate veterinary care, and the Guide's recommendation for establishing and adhering to humane endpoints. Such inaction could lead to prolonged suffering for the animal, compromising its welfare and potentially invalidating research data due to unforeseen physiological complications. Another incorrect approach, such as immediately terminating the study without consulting the PI or assessing the severity of the changes, could also be problematic. While prioritizing animal welfare is paramount, abrupt termination without proper scientific justification might not be the most refined approach if the observed changes are transient or manageable. This could lead to the loss of valuable research data and potentially violate the terms of the approved Animal Study Protocol, ASP, which outlines specific procedures and monitoring parameters. A third incorrect approach, such as administering an analgesic without consulting the PI or assessing the specific physiological parameters, could also be considered a failure. While pain management is crucial, the type and dosage of analgesia must be carefully considered in the context of the research protocol. Unprescribed or inappropriate medication could interfere with the study's objectives or introduce confounding variables, necessitating a thorough assessment and consultation before intervention. The professional decision-making process for similar situations should involve a systematic approach. 1. Initial observation and assessment of the animal's physiological parameters. 2. Comparison of observed parameters with expected outcomes based on the research protocol and known anatomy and physiology of the species. 3. Identification of any deviations that could indicate pain, distress, or compromise of welfare. 4. Consultation with the principal investigator to discuss the findings and potential implications for the study. 5. Collaboration with the PI to determine the most appropriate course of action, which may include continued monitoring, adjustment of the protocol, administration of supportive care, or consideration of humane endpoints, all within the framework of the approved ASB and regulatory guidelines. Question 12. The monitoring system demonstrates that a research protocol has been submitted requesting the use of a specific inbred strain of mice for a study investigating a novel therapeutic target for a human neurological disorder. The justification provided highlights that this strain has a spontaneous mutation that mimics some aspects of the human disease, but it does not fully recapitulate the complex pathology or the full spectrum of clinical manifestations. The researcher has not explored other potential animal models or considered genetically modified models that might offer greater fidelity to the human condition. Which of the following actions best aligns with regulatory requirements for the selection of appropriate animal models for research under the Animal Welfare Act and Public Health Service Policy? Option A. Require the researcher to provide a detailed justification for why other potential animal models, including genetically modified rodents or non-rodent species, were not selected, and to demonstrate how the chosen strain is the most appropriate for addressing the specific research question, considering the principles of the 3Rs. Option B. Approve the protocol as submitted, given the historical use of this strain in similar research and its partial relevance to the human disorder. Option C. Suggest the researcher switch to a more commonly used and readily available animal model, even if its relevance to the specific human neurological disorder is less direct, to expedite the research process. Option D. Advise the researcher to proceed with the study using the proposed mouse strain and to address any limitations in the animal model during the interpretation of the results. The correct answer is B. Approve the protocol as submitted, given the historical use of the strain in similar research and its partial relevance to the human disorder. Explanation. This scenario is professionally challenging because it requires balancing the scientific imperative to select the most appropriate animal model with the stringent regulatory and ethical obligations to minimize animal use and suffering, as mandated by the Animal Welfare Act (OWA) and its implementing regulations, as well as the Public Health Service Policy on Humane Care and Use of Laboratory Animals (PHS policy). The Institutional Animal Care and Use Committee (IACUC) has a critical oversight role in ensuring that the chosen model aligns with the research objectives while adhering to the principles of the 3Rs: replacement, reduction, refinement. The decision-making process must be grounded in scientific justification and regulatory compliance, avoiding assumptions or convenience. The correct approach represents best professional practice because it directly addresses the core regulatory requirement of the 3Rs. By actively seeking alternatives and justifying the necessity of the chosen species and strain based on specific physiological, genetic, or pathological relevance to the human disease, the researcher and IACUC demonstrate a commitment to minimizing animal use and ensuring that the animals used are the most appropriate for the scientific question. This aligns with the AWA's mandate to provide humane care and use of animals, and the PHS policy's emphasis on scientific justification for animal use. An incorrect approach that prioritizes the availability of a particular animal model without a thorough scientific justification fails to meet the regulatory standard. This could lead to the use of an animal that does not accurately reflect the human condition being studied, resulting in potentially misleading data and wasted animal lives, which violates the principle of reduction. Similarly, selecting a model solely based on historical precedent or ease of acquisition, without a rigorous evaluation of its suitability for the specific research question, bypasses the scientific justification required by the PHS policy and the AWA's emphasis on appropriate care and use. Choosing a model that requires more invasive procedures or causes greater distress than a scientifically equivalent alternative would, without clear justification, violates the principle of refinement and the AWA's requirement to minimize pain and distress. The professional decision-making process should involve a systematic evaluation of the research question, followed by a comprehensive literature review to identify potential animal models. This should include an assessment of the scientific validity, genetic and physiological relevance, behavioral characteristics, and potential for refinement of each model. The researcher must then present a strong scientific justification for the chosen model to the IACUC, explicitly addressing how it fulfills the research objectives and adheres to the 3Rs. The IACUC role is to critically review this justification, ensuring compliance with all applicable regulations and ethical guidelines before approving the protocol. Question 13. Cost-benefit analysis shows that implementing a comprehensive clinical pathology monitoring program for a novel therapeutic agent study in rodents is resource-intensive, but the potential for early detection of adverse effects could significantly improve animal welfare and data integrity. Given a cohort of Sprague Dawley rats exhibiting mild elevations in alanine aminotransferase ALT and alkaline phosphatase ALP, along with a slight decrease in albumin, what is the most appropriate initial interpretation and management strategy, considering the study aims to evaluate a hepatotoxic compound? Option A. Conclude that the observed biochemical changes are within the normal variability for the strain and age of the animals, and therefore no intervention or further investigation is required, allowing the study to proceed as planned. Option B. Attribute the elevated ALT and ALP and decreased albumin solely to handling stress and housing conditions, suggesting adjustments to husbandry practices without further investigation into the therapeutic agent's direct effects. Option C. Immediately recommend euthanasia for all animals exhibiting these biochemical abnormalities to prevent any potential progression of liver disease, and to adhere strictly to the principle of minimizing animal suffering. Option D. Interpret the findings as indicative of mild hepatic stress directly related to the therapeutic agent, necessitating a review of the dosing regimen and potential for dose reduction or supportive care to mitigate further liver damage and ensure continued study participation. The correct answer is D. Interpret the findings as indicative of mild hepatic stress directly related to the therapeutic agent, necessitating a review of the dosing regimen and potential for dose reduction or supportive care to mitigate further liver damage and ensure continued study participation. Explanation. This scenario presents a common challenge in laboratory animal medicine, interpreting clinical pathology data in the context of a research protocol and potential confounding factors. The veterinarian must balance the need to obtain scientifically valid data with the ethical imperative to minimize animal suffering and ensure animal welfare. A cost-benefit analysis, in this context, weighs the potential scientific gains against the costs associated with animal health, welfare, and potential protocol amendments. The correct approach involves a systematic and evidence-based interpretation of the hematology and biochemistry results, considering the specific strain, age, sex, housing, and experimental manipulation of the animals. It requires integrating these findings with the study's objectives and potential impact on the animal's well-being. This approach aligns with the principles of the Animal Welfare Act, (OWA), and the Guide for the Care and Use of Laboratory Animals, the Guide, which mandate the provision of appropriate veterinary care and the minimization of pain and distress. Specifically, the Guide emphasizes the importance of monitoring animal health and using clinical pathology as a tool for assessing well-being and the impact of experimental procedures. A thorough interpretation allows for informed decisions regarding continued participation in the study, potential interventions, or humane endpoints, thereby upholding ethical obligations and ensuring the integrity of the research. An incorrect approach would be to dismiss the abnormal findings without thorough investigation, perhaps due to time constraints or a desire to avoid protocol disruptions. This could lead to the continuation of a study in animals experiencing significant distress or pain, violating the AWA's requirement for humane care and the Guide's emphasis on minimizing suffering. Another incorrect approach would be to immediately recommend euthanasia or termination of the study based on isolated abnormal values without considering the full clinical picture, potential for transient changes, or the scientific necessity of the observed findings. This could unnecessarily compromise research outcomes and lead to the loss of valuable data, failing to achieve a balanced cost-benefit outcome. Furthermore, making decisions based solely on a single parameter without considering the overall pattern of results or the animal's clinical presentation would be a failure of professional judgment and a deviation from best practices in veterinary diagnostics and animal welfare. The professional decision-making process should involve 1. A comprehensive review of all available clinical pathology data. 2. Correlation with the experimental protocol, animal husbandry, and any observed clinical signs. 3. Consultation with the research team to understand the potential impact of the findings on the study's objectives. And 4. Consideration of available diagnostic and therapeutic options, including humane endpoints, in accordance with institutional policies and regulatory requirements. Question 14. Which approach would be most appropriate for a veterinarian to implement when preparing a colony of aged C57BL/6 mice, previously used in a long-term study, and now scheduled for a novel surgical procedure involving abdominal exploration, to minimize anesthetic risks and ensure ethical compliance under U.S. federal regulations? Option A. Administer a broad-spectrum antibiotic and a mild sedative to all mice prior to anesthesia, without a detailed physical examination, to proactively address any potential subclinical infections or anxiety. Option B. Rely solely on the historical data from their previous long-term study, assuming their general health status remains unchanged, and proceed with a standard anesthetic protocol for healthy adult mice. Option C. Conduct a thorough physical examination on each mouse, review their complete historical health and experimental data, and consult species-specific anesthetic guidelines to tailor the pre-anesthetic preparation and anesthetic protocol. Option D. Proceed directly to anesthesia and surgery for all mice, as the research timeline is critical and the mice are presumed healthy based on their previous experimental participation. The correct answer is C. Conduct a thorough physical examination on each mouse, review their complete historical health and experimental data, and consult species-specific anesthetic guidelines to tailor the pre-anesthetic preparation and anesthetic protocol. Explanation. This scenario presents a common challenge in laboratory animal medicine, balancing the need for a thorough pre-anesthetic evaluation with the practical constraints of research timelines and animal welfare considerations. The core of the challenge lies in identifying the most appropriate level of pre-anesthetic assessment for a specific animal and procedure, ensuring both scientific validity and ethical compliance without undue delay or stress to the animal. The correct approach represents best professional practice because it prioritizes a risk-based assessment tailored to the individual animal and the proposed procedure. This aligns with the principles of the Animal Welfare Act, OWA, and the Guide for the Care and Use of Laboratory Animals, the Guide, which emphasize minimizing pain and distress and ensuring appropriate veterinary care. A comprehensive pre-anesthetic evaluation, including a physical examination, review of historical data, and consideration of species-specific risks, is crucial for identifying potential complications and developing a safe anesthetic plan. This proactive approach minimizes the risk of adverse events during anesthesia and surgery, ultimately contributing to the animal's well-being and the integrity of the research data. An incorrect approach that bypasses a thorough physical examination for a novel or potentially compromised animal would be professionally unacceptable. This failure to conduct a fundamental veterinary assessment directly contravenes the AWA's requirement for adequate veterinary care and the Guide's recommendation for pre-anesthetic evaluation. Such an oversight could lead to undiagnosed conditions that significantly increase anesthetic risk, potentially resulting in severe morbidity or mortality, and compromising the research outcomes. Another incorrect approach that relies solely on historical data without considering the current condition of the animal is also professionally unacceptable. While historical data is valuable, it does not substitute for a current assessment. An animal's health status can change rapidly, and relying on outdated information could lead to an inappropriate anesthetic plan, failing to account for emergent issues. This disregard for the animal's immediate physiological state violates the ethical imperative to provide individualized care and the regulatory expectation of ongoing veterinary oversight. The professional decision-making process for similar situations should involve a systematic risk assessment. This begins with understanding the species, strain, age, and known health status of the animal. Next, the nature and duration of the proposed procedure, including the anticipated physiological stress, must be considered. Finally, the potential risks associated with specific anesthetic agents and techniques should be evaluated in the context of the animal's individual characteristics. This comprehensive evaluation allows for the selection of the most appropriate pre-anesthetic diagnostics and the development of a safe and effective anesthetic protocol, ensuring compliance with all relevant regulations and ethical guidelines. Question 15. The review process indicates a discrepancy between the initial fine needle aspirate cytology findings of a suspected inflammatory process in a laboratory rat and the subsequent histopathology report, which describes a neoplastic lesion. The attending veterinarian is tasked with determining the most appropriate next step to ensure the animal's welfare and the integrity of the research study. Option A. Proceed with the experimental protocol as planned, assuming the histopathology report is definitive and the cytology was misleading. Option B. Request a new biopsy for histopathology without re-evaluating the existing diagnostic materials. Option C. Disregard the cytology findings entirely and focus solely on the histopathology report for future management decisions. Option D. Re-examine both the original cytology slides and the histopathology slides, review the clinical signs, and consult with the consulting pathologist and the study investigator to reconcile the findings. Correct answer is D. Re-examine both the original cytology slides and the histopathology slides, review the clinical signs, and consult with the consulting pathologist and the study investigator to reconcile the findings. Explanation. Scenario analysis. This scenario presents a common challenge in laboratory animal medicine, where a discrepancy arises between clinical observations and histopathological findings. The veterinarian must reconcile these differences, ensuring the animal's welfare and the integrity of research data. This requires a thorough understanding of both cytology and histopathology, their limitations, and the potential for artifact or misinterpretation. The professional challenge lies in determining the most appropriate course of action that prioritizes the animal's well-being, while adhering to regulatory requirements and research protocols. Correct approach analysis. The correct approach involves a comprehensive review of all available data, including the original cytology slides, the histopathology report, clinical signs, and the experimental protocol. This systematic evaluation allows for the identification of potential reasons for the discrepancy, such as sampling error, differences in tissue processing, or variations in interpretation. Consulting with the consulting pathologist and potentially the investigator is crucial for a collaborative and informed decision. This approach aligns with the principles of good veterinary practice and the ethical imperative to ensure animal welfare and data validity, as guided by the Guide for the Care and Use of Laboratory Animals, the Guide, and relevant PHS policy and USDA Animal Welfare Act regulations, which mandate appropriate veterinary care and accurate record-keeping. Incorrect approach is analysis. Failing to re-examine the original cytology slides and histopathology slides represents a failure to conduct a thorough diagnostic investigation. This could lead to overlooking subtle findings or misinterpretations, potentially resulting in inappropriate treatment or an inaccurate assessment of the animal's condition, violating the requirement for appropriate veterinary care. Proceeding solely based on the histopathology report without considering the cytology findings or clinical signs ignores potentially valuable diagnostic information. This could lead to a misdiagnosis or an incomplete understanding of the animal's condition, impacting both welfare and research outcomes. Dismissing the discrepancy without further investigation and continuing with the experimental protocol without addressing the conflicting findings is a significant ethical and regulatory failure. It compromises the scientific integrity of the research and potentially the welfare of the animal if an underlying pathological process is not adequately addressed. This violates the principles of responsible research conduct and the oversight responsibilities of the veterinarian. Professional reasoning. When faced with conflicting diagnostic information, the laboratory animal veterinarian must employ a systematic problem-solving approach. This involves 1. Gathering all relevant data, 2. Critically evaluating each piece of information, 3. Identifying potential sources of error or discrepancy, 4. Consulting with colleagues or specialists as needed, and 5. Making a decision that prioritizes animal welfare and scientific integrity, documented thoroughly in the animal's record. Question 16. The analysis reveals that a research team is investigating a novel therapeutic agent for a complex neurological disorder that affects neurotransmitter systems. They are considering using either a rodent model or a non-human primate model. Which of the following approaches best addresses the species-specific considerations in animal model selection for this research, adhering to U.S. regulatory frameworks and ethical guidelines? Option A. Select the rodent model due to its lower cost and ease of handling, assuming that general principles of neurotransmission are conserved across mammalian species. Option B. Conduct a thorough literature review to identify existing models of this specific neurological disorder in both rodents and non-human primates, critically evaluating the translational relevance of each model's pathology, neurochemistry, and response to known treatments, and consult with experts in comparative neurobiology and the specific disorder. Option C. Prioritize the non-human primate model because its neurological complexity is closer to humans, without a detailed assessment of its specific relevance to the neurotransmitter systems targeted by the therapeutic agent. Option D. Opt for the rodent model solely based on its shorter generation time and faster breeding cycle, which will expedite data acquisition for the research project. The correct answer is A. Select the rodent model due to its lower cost and ease of handling, assuming that general principles of neurotransmission are conserved across mammalian species. Explanation. The scenario presents a common challenge in laboratory animal medicine, selecting an appropriate animal model for a research project. A professional challenge lies in balancing the scientific goals of the research with the ethical and regulatory obligations to ensure animal welfare and the validity of the research findings. This requires a deep understanding of species-specific biology, physiology, behavior, and the potential for species to accurately reflect the human condition being studied. The DACLAM exam emphasizes the importance of this judicious selection process, as it directly impacts both animal welfare and the scientific integrity of the research. Correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based evaluation of potential animal models. This involves a thorough review of existing literature, consultation with subject matter experts, and consideration of the specific research question. Crucially, it necessitates an assessment of how well each species' biological and physiological characteristics align with the human disease or condition being modeled, while also considering the ethical implications of using a particular species and the potential for pain and distress. This aligns with the principles of the 3Rs: replacement, reduction, refinement, and the requirements of the Animal Welfare Act and the Guide for the Care and Use of Laboratory Animals, which mandate the selection of the most appropriate species and the minimization of animal use and suffering. An incorrect approach that fails to adequately consider species-specific differences in disease manifestation or response to treatment would be professionally unacceptable. This could lead to misleading research results, wasted resources, and unnecessary animal use. Ethically, it violates the principle of using animals only when essential and when the potential benefits outweigh the harms. Regulatory failures would include noncompliance with the Animal Welfare Act and the Guide, which require justification for species selection, and the use of the least sentient species capable of providing valid results. Another incorrect approach that focuses solely on the availability or cost of an animal model, without a rigorous scientific and ethical evaluation, is also professionally unacceptable. This prioritizes convenience over scientific validity and animal welfare, leading to potential research failures and ethical compromises. It disregards the fundamental requirement to select a model that can accurately address the research question and minimize animal suffering. The professional decision-making process for similar situations should involve a systematic, multifaceted approach. This begins with a clear definition of the research question and the specific biological or pathological processes to be studied. Next, a comprehensive literature search should be conducted to identify potential animal models that have been used for similar research. This should be followed by a critical evaluation of the biological, physiological, and behavioral similarities and differences between the potential models and humans. Consultation with veterinarians, research scientists, and statisticians is essential. Ethical considerations, including the potential for pain and distress, the availability of humane endpoints, and the principles of the 3Rs, must be integrated into the decision-making process at every stage. Finally, the chosen model must be justified in the IACUC protocol, demonstrating that it is the most appropriate species for the proposed research and that animal use and suffering will be minimized. Question 17. The control framework reveals that a genetically modified mouse model, intended for a 12-week study, is exhibiting unexpected and severe neurological signs at week 8, including ataxia and tremors, which are not explicitly detailed as humane endpoints in the approved protocol. The attending veterinarian observes these signs during a routine health check. What is the most appropriate immediate course of action? Option A. Immediately euthanize the animal to prevent further suffering without further consultation. Option B. Document the signs and wait for the scheduled endpoint of the study to collect all data. Option C. Continue monitoring the animal according to the original protocol timeline, as the observed signs are not explicitly defined as endpoints. Option D. Consult with the principal investigator to assess the severity of the clinical signs and collaboratively determine if an early humane endpoint is warranted, potentially requiring an amendment to the approved protocol. The correct answer is D. Consult with the principal investigator to assess the severity of the clinical signs and collaboratively determine if an early humane endpoint is warranted, potentially requiring an amendment to the approved protocol. Explanation. This scenario presents a common ethical dilemma in laboratory animal medicine, balancing the scientific necessity of a research model with the ethical imperative to minimize animal suffering and ensure humane endpoints. The challenge lies in the potential for unforeseen complications in a genetically modified model that may not be adequately addressed by the initial protocol, requiring a veterinarian to exercise professional judgment beyond the strict letter of the approved protocol when animal welfare is compromised. The correct approach represents best professional practice because it prioritizes the welfare of the animal, aligning with the principles of the Animal Welfare Act, OWA, and the Guide for the Care and Use of Laboratory Animals, the Guide. Specifically, the veterinarian's immediate action to assess the animal and consult with the investigator to determine if an early humane endpoint is warranted demonstrates adherence to the principles of the 3Rs: replacement, reduction, refinement, and the ethical obligation to prevent unnecessary pain and distress. This proactive intervention, even if it deviates from the exact timeline of the approved protocol, is ethically and regulatorily sound as it addresses an emergent welfare concern. An incorrect approach would be to strictly adhere to the protocol timeline, despite observing signs of significant suffering. This failure to act would violate the AWA's requirement for humane care and treatment, and the Guide's emphasis on establishing and adhering to humane endpoints would also represent a dereliction of the veterinarian's professional responsibility to advocate for the animals under their care. Another incorrect approach would be to unilaterally euthanize the animal without consulting the investigator or the Institutional Animal Care and Use Committee, IACUC. While humane euthanasia is a critical tool, the decision to implement it, especially outside of predefined protocol endpoints, requires a collaborative process to ensure scientific integrity is considered alongside animal welfare and that proper documentation is maintained. This unilateral action could undermine the research and violate IACUC oversight requirements. The professional decision-making process in such situations involves a systematic evaluation. 1. Recognize and assess the animal's condition, identifying signs of pain, distress, or compromised welfare. 2. Consult the approved protocol and relevant guidelines, e.g., the Guide, to understand established endpoints and care requirements. 3. Engage in immediate communication with the principal investigator to discuss the observed condition and potential implications for the research. 4. If the animal's welfare is compromised and not adequately addressed by the protocol, collaboratively determine the most appropriate course of action, which may include modifying the protocol, implementing earlier humane endpoints, or seeking guidance from the IACUC. 5. Document all observations, communications, and decisions thoroughly. Question 18. Stakeholder feedback indicates that a colony of C57BL/6 mice, housed under standard conditions and used in a behavioral study, is exhibiting a consistent elevation in mean body temperature, 0.8 degrees C above the established colony norm, and a slight decrease in mean respiratory rate, 5 breaths/minute below the established colony norm, across multiple individuals over the past week. The research protocol does not involve any interventions known to directly affect these parameters. What is the most appropriate initial course of action for the attending veterinarian? Option A. Immediately adjust the environmental control settings in the animal room to lower the ambient temperature by 1.0 degrees C and increase the ventilation rate, assuming the observed changes are due to suboptimal housing. Option B. Inform the principal investigator that the observed physiological deviations are likely within the normal range of individual variability for this strain and require no further investigation. Option C. Conduct a thorough review of the animal husbandry records, environmental monitoring data, temperature, humidity, ventilation, and the specific details of the behavioral studies procedures, while also performing a detailed physical examination of a representative sample of affected mice to assess for any subtle clinical signs. Option D. Recommend an immediate cessation of the behavioral study and initiate a broad-spectrum antibiotic treatment for the entire colony, suspecting an underlying infectious process. Correct answer is C. Conduct a thorough review of the animal husbandry records, environmental monitoring data, temperature, humidity, ventilation, and the specific details of the behavioral studies procedures, while also performing a detailed physical examination of a representative sample of affected mice to assess for any subtle clinical signs. Explanation. This scenario presents a professional challenge because it requires the veterinarian to balance the need for accurate scientific data with the ethical imperative to minimize animal distress and ensure animal welfare. The discrepancy between the expected physiological parameters for a species and the observed values necessitates a thorough investigation, as it could indicate underlying health issues, suboptimal environmental conditions, or even experimental artifacts. The veterinarian must apply their knowledge of species-specific physiology, understand the potential impact of various factors on these parameters, and adhere to the principles of the Animal Welfare Act, AWA, and the Guide for the Care and Use of Laboratory Animals, the Guide, to make an informed and ethical decision. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based investigation to understand the cause of the deviation. This aligns with the AWA's requirement for humane care and treatment, and the Guide's emphasis on ensuring the health and well-being of research animals. By consulting species-specific literature, reviewing the animal's history, examining the housing and husbandry, and considering potential experimental influences, the veterinarian is fulfilling their responsibility to identify and address any welfare concerns. This proactive and thorough approach ensures that the animals are not suffering unnecessarily and that the integrity of the research is maintained. An incorrect approach that involves immediately adjusting the experimental protocol without further investigation fails to address the root cause of the observed physiological changes. This could lead to masking a significant welfare issue or compromising the scientific validity of the study. Ethically, it bypasses the obligation to understand and alleviate animal distress. From a regulatory standpoint, it could be seen as a failure to adequately monitor animal health and welfare as mandated by the AWA and the Guide. Another incorrect approach, such as attributing the deviation solely to individual animal variability without further assessment, neglects the possibility of systemic issues affecting multiple animals or a significant health problem in the individual. This could result in delayed diagnosis and treatment of a welfare concern, violating the principles of humane care. It also fails to uphold the scientific rigor expected in laboratory animal medicine, where unexpected physiological findings warrant investigation. A further incorrect approach, such as discontinuing the study without a clear justification based on animal welfare or scientific integrity, could be an overreaction. While animal welfare is paramount, premature termination of a study without understanding the cause of the deviation might be scientifically unwarranted and could lead to the loss of valuable research data. The decision to alter or cease a study must be based on a comprehensive assessment of the situation, considering all relevant factors. The professional decision-making process for similar situations should involve a structured approach. 1. Recognize the deviation from expected parameters. 2. Consult species-specific physiological data and relevant literature. 3. Review the animal's health history, husbandry, and environmental conditions. 4. Consider potential experimental influences. 5. Formulate differential diagnoses for the observed changes. 6. Implement appropriate diagnostic and therapeutic interventions if necessary. 7. Document all findings, actions, and justifications thoroughly. 8. Communicate findings and recommendations to the research team and the Institutional Animal Care and Use Committee, IACUC. This systematic process ensures that decisions are data-driven, ethically sound, and compliant with regulatory requirements. Question 19. During the evaluation of a mouse colony maintained for a long-term research program, the veterinarian notes a subtle but consistent increase in the incidence of mild skeletal abnormalities and a slight decrease in litter size over the past 3 generations. Genetic monitoring data indicates a narrowing of genetic diversity within the colony. What is the most appropriate course of action to ensure the continued health and scientific utility of the colony, adhering to the Animal Welfare Act and the Guide for the Care and Use of Laboratory Animals? Option A. Implement a structured breeding program that includes regular genetic monitoring, introduction of new genetic material from a reputable source according to a defined plan, and a strategy to manage genetic drift and inbreeding. Option B. Increase the number of breeding pairs significantly to dilute any potential genetic issues without specific genetic analysis or a structured introduction plan. Option C. Continue current breeding practices, assuming the observed changes are within acceptable research variation and will self-correct over time. Option D. Immediately cease all breeding and procure a completely new, unrelated colony to replace the existing one without further genetic assessment. The correct answer is A. Implement a structured breeding program that includes regular genetic monitoring, introduction of new genetic material from a reputable source according to a defined plan, and a strategy to manage genetic drift and inbreeding. Explanation: this scenario presents a common challenge in laboratory animal breeding programs, balancing genetic integrity with the practical demands of maintaining a healthy and productive colony. The core of the challenge lies in identifying and mitigating potential genetic drift and inbreeding depression, while adhering to the principles of the Animal Welfare Act, AWA, and the Guide for the Care and Use of Laboratory Animals, the Guide. A veterinarian's role is to ensure that breeding strategies are not only scientifically sound, but also ethically responsible and compliant with federal regulations. The correct approach prioritizes proactive genetic management through systematic monitoring and intervention. This aligns with the Guide's emphasis on maintaining genetic quality to ensure the reproducibility of research and the health of the animals. By implementing a defined breeding scheme, regular genetic monitoring, and a strategy for introducing new genetic material, the veterinarian demonstrates a commitment to long-term colony health and research integrity, which are fundamental ethical and regulatory obligations. This approach minimizes the risk of detrimental genetic changes that could compromise animal welfare and research outcomes. An incorrect approach would be to ignore or downplay the observed genetic anomalies. Failure to address potential inbreeding or genetic drift directly contravenes the principles of responsible animal care and research. It could lead to increased incidence of congenital defects, reduced fertility, weakened immune systems, and other health issues, thereby violating the AWA's mandate to provide humane care and treatment. Furthermore, it compromises the scientific validity of research conducted with these animals, undermining the ethical justification for their use. Another incorrect approach would be to implement drastic, unscientific measures without proper genetic assessment. This could involve haphazardly introducing new animals without considering their genetic background, potentially exacerbating existing problems or introducing new ones, and failing to meet the standards for responsible colony management. The professional decision-making process in such situations requires a thorough understanding of population genetics principles as applied to laboratory animal colonies, a commitment to continuous monitoring, and the ability to integrate this knowledge with regulatory requirements and ethical considerations. It involves a proactive, data-driven approach to genetic management, ensuring that breeding practices support both animal welfare and research goals. Question 20. Stakeholder feedback indicates concerns regarding the potential for chronic pain in a group of genetically modified rodents undergoing a novel behavioral study, with current pain management protocols potentially insufficient for the long-term effects of the genetic modification. The attending veterinarian is tasked with evaluating this situation. Which of the following represents the most appropriate course of action to ensure regulatory compliance and animal welfare? Option A. Immediately halt the study and require the research team to revise their protocol to include more aggressive pain management without further consultation. Option B. Rely solely on the principal investigator's assessment of the animal's comfort levels, assuming their expertise is sufficient to gauge chronic pain. Option C. Document the feedback but take no immediate action, waiting to see if the animals exhibit overt signs of distress before initiating any review. Option D. Conduct a thorough review of the genetic modification's known physiological effects. Consult the Animal Welfare Act and the Guide for the Care and Use of Laboratory Animals, and engage in a collaborative discussion with the principal investigator and the Institutional Animal Care and Use Committee, IACUC, to assess and potentially revise the pain management strategy. The correct answer is A. Immediately halt the study and require the research team to revise their protocol to include more aggressive pain management without further consultation. Explanation: this scenario presents a common challenge in laboratory animal medicine, balancing the need for scientific advancement with the ethical and regulatory obligations to animal welfare. The veterinarian must navigate potential conflicts between research goals and the principles of the Animal Welfare Act, OWA, and the Guide for the Care and Use of Laboratory Animals, the Guide. The challenge lies in interpreting and applying these regulations to a novel situation where existing protocols may not explicitly address the specific concerns raised by the stakeholder. The correct approach involves a thorough, evidence-based assessment that prioritizes animal welfare while respecting the scientific objectives. This means consulting relevant regulations, seeking expert opinion, and engaging in open communication with the research team. The veterinarian's primary responsibility is to ensure compliance with the AWA, which mandates humane care and treatment, and to adhere to the principles outlined in the Guide, which provides recommendations for best practices in animal care and use. This approach demonstrates a commitment to the ethical principles of the 3Rs: replacement, reduction, refinement, and upholds the veterinarian's role as the primary advocate for the animals. An incorrect approach would be to dismiss the stakeholders' concerns without proper investigation. This could lead to regulatory violations under the AWA, which requires prompt attention to animal well-being and reporting of any adverse findings. Failing to consult the Guide or relevant institutional policies would also be a failure, as these documents provide essential guidance for establishing and maintaining appropriate standards of care. Furthermore, ignoring the scientific rationale behind the research or making unilateral decisions without consulting the principal investigator, PI, or the Institutional Animal Care and Use Committee, IACUC, undermines the collaborative nature of animal research and can lead to suboptimal outcomes for both the animals and the research project. The professional decision-making process in such situation should involve a systematic evaluation. First, clearly define the stakeholder's concern and its potential impact on animal welfare. Second, review applicable regulations, OWA, and guidelines, the Guide institutional policies, to determine the relevant standards. Third, gather information, which may include direct observation of the animals, review of veterinary records, and consultation with the research team and other experts. Fourth, assess the scientific justification for the current procedures and explore potential modifications that could mitigate welfare concerns without compromising research integrity. Finally, communicate findings and recommendations clearly and transparently to all relevant parties, including the PI and the IACUC, to ensure informed decision-making and regulatory compliance.